vena cava. The opening for the inferior vena cava on this guy really didn't get done too well. They cut him too close, so your inferior opening would be there. Then right here, that opening is the opening to the left atrium, so it's the pulmonary vein. This would be inferior, this would be superior. Here is your brachiocephalic. Make sense? So put it on yourself. Make sure you have the vessel on the diagonal in the front. Go directly behind it. That's the aorta. Then the brachiocephalic. Directly behind brachiocephalic would be the opening for superior. Slightly to the left is the opening for the inferior. And then a little bit more left, and you're going to have the opening for the pulmonary veins. Now, on this part, you do have the junction between the pulmonary artery and the aorta. That's the ligamentum arteriosum. This structure right here. Here is my left atrium. My right atrium has gotten chopped a little bit, but this would be the right atrium. Here is the anterior interventricular sulcus. That's going to contain the coronary arteries and the coronary veins. And it looks like actually you're going to have a little piece of blood clot in the right side, especially when you can see a depression like that. Those are the vessels. This would be your visceral pericardium. I've taken off most of your parietal pericardium.
Where would that have been?
It would have been on the back side. It's usually a sac that's going to surround the heart. That would be the parietal pericardium. Okay? So if I go to the left of the anterior interventricular septum, or sulcus, this would be my left ventricle, this would be my right ventricle. It makes sense because this is the left atrium. Right there would be the right atrium. So right ventricular side, left ventricular side. Left side big, right side small. Okay?